Hi, I am Dr. Gautam Bhandari, Consultant Physician, Manidhari Hospital and Malu Neuro Center, Jodhpur, and Secretary API Jodhpur. In this Mega Fest, APICON 2022 at Jaipur, I discussed cutaneous manifestations of liver disorders. In clinical practice these days, we are moving towards more and more investigations, which is detrimental to us and patients both. In old golden days, we were taught history and clinical examination is more important, and of the clinical examination, general physical examination is equally important. Clinical examination of skin guides us for early diagnosis in many diseases. Skin is the largest organ and it reflects the status of many internal organs. Of these, the hepatic disorders, commonly they have a early presentation as cutaneous manifestations. So if we look properly for the skin, we can diagnose hepatic disorders early. The common cutaneous manifestations are hyperpigmentation, vascular changes, coagulation defects, pruritus and xerosis, and of these. But the most important thing is these cutaneous manifestations are never specific. Like not we see a cutaneous manifestation and we diagnose. No, we have to correlate with history and other signs and symptoms and then confirm it by other investigations. So we can get a early diagnosis. Suppose I give you an example. We see spider angiomas, we see palmar erythema, and we see white nails. It is likely that we are dealing with a case of cirrhosis. Then we need to go for investigations to confirm it. We can get a early diagnosis. To say another example, we can suppose there is a case of hyperpigmentation with xanthomas and xanthelasmas, jaundice and pruritus. There is a chance of primary biliary cirrhosis. So in this way, I would say some common ones, we should look for spider nevi, caput medici, terry nails, leukonychia. We should see the consistency of the hair. Usually they are thinner and the pattern is changed many times. If we see a bronze hue of the skin, we should think of hemochromatosis. If we see a muddy sclera and all these xanthomas and xanthelasmas, we can think of primary biliary cirrhosis. Like this, these are especially in hepatitis B and C, we can see this porphyria cutaneous tarda and many other skin manifestations. But all these need to be correlated. They are not, suppose in liver disorders we see clubbing, but that doesn't mean if you have a clubbing then there is a liver disorder. It need to be correlated with other signs and symptoms and confirmed by investigations. So they are the early markers and they need to be related clinically. So the carry-home message is we should have a look on the skin and try to corroborate and analyze the things and then go for investigations so that we can identify liver disorders early and treat them in time. Thank you.